In this video, we will be discussing another bacterial disease, that is Glanders, which is clinically manifested as the acute and chronic form. Chronic form is mainly noticed in horse, whereas the acute form is noticed in mule and donkey, which is caused by the gram-negative rod, that is Burkholderia malei, which is also called as the Pseudomonas malei. When it comes to epidemiology of the disease, this disease will be occurring mainly in the Equidae family animals, and which affect the all age group animals, which is a genetic one. And in case of humans, this disease is fatal, and which is transmitted via the contaminated feed and water, and the bacteria may get enter the body via skin aberrations. Now look at the pathogenesis of the disease. After ingestion of the contaminated feed and water, the bacteria will reach the intestine, where again it will the absorption of the bacteria along with the feed will be occurring, and by that absorption, the contaminated source, that is nothing but the bacteria, will be entering the blood circulation, where it will multiply and produce toxins, and that condition is known as the septicemic condition. And through that septicemia, the blood will be circulating to nasal mucosa, the other bones and lungs, and skins and the hind limbs. So wherever the blood will be circulating and those areas, this bacteria will be localizing. Especially this bacteria has got affinity for towards the pulmonary system and the nasal system, as well as the skin form, then leading to the nodules development in the nasal cavity and the skin, and those nodules will be converting into ulcers, and then they will be break out and leading to the pus discharge. And some of the important points regarding this pathogens is that in hind limbs, the lymphangitis and the lymphadenitis will be occurring. Lymphadentis is nothing but the inflammation of lymph nodes, whereas the lymphangitis is the inflammation of lymph vessels. The whatever the lymph nodes which are present on the hind limbs, and they will be swollen, and they will be break open to produce a dark honey colored pus, and the swollen lymph nodes all along the blood, all along the leg, which is known as the farcy bud. The farcy is the term which is given for uh, the skin form of this disease, that is nothing but the cutaneous form of Glanders, is known as the farcy. So the swollen lymph nodes is known as the farcy bud, and the lymph vessels are become thickened, and they will become the cord like. So the term they have given for that is farcy cord, farcy bud and farcy cord. Farcy cord is related with the lymph vessels, whereas the farcy bud is with lymph nodes. And apart from this, there is the affection for the lungs, where one will notice the bronchopneumonia, and miliary tubercles like nodules, growth of small miliary tubercles like nodules will be there in the lungs. And now let us look at the clinical findings. In acute form, that will be noticed in mule and donkey, where the high fever, nasal discharge, coughing, and the nodules in the nasal mucosa and the skin will be there, and the death within the few days, that is because of the septicemic condition. And in case of chronic form, which is mainly noticed in horse, where the three forms of disease will be manifested, and the first one is the pulmonary, nasal, and the skin, and sometimes the fourth is nasal or the skin form. In pulmonary form, the chronic pneumonia will be there. That will be manifested as the coughing, labored respiration, that is difficult in respiration, and frequent epistaxis will be there, that is nothing but the oozing of blood from the nasal orifices. And in case of nasal form, where the nasal secretion will be initially that will be serous, then it become purulent, where the time will be going on, and sometime there will be bloody tinged nasal secretion will be there, and sometimes there will be nodules formation in the nasal mucosa and around the terminate bone, and those nodules will be break down to form the ulcers, and sometimes the submaxillary lymph nodes are also swollen. And in case of the cutaneous form, which is also known as the farcy, and there will be formation of nodules and ulcers which break open to release the pus. Now when we go for necropsy, and where one can find out in acute condition, multiple petechial hemorrhages throughout the body can be noticed, and bronchopneumonia, enlarged bronchial lymph nodes will be there. And in chronic form, throughout the lungs, there will be a small miliary tubercle like lesions will be there, and nodules on the skin and subcutaneous will be there. And to diagnose this disease, mainly based on clinical signs and sometimes the demonstration of the organism. To demonstrate the organism, one can collect the samples like pus, and can culture it, and isolate the bacteria can be done. And the main important is that the allergic test, and these are the screening test. Thereby there are mainly two tests are carried out. The first one is the Malin test. Malin is an antigen which is injected into the suspected animal via subcutaneous or the ophthalmic route, or intradermal, palpebral, or simply intradermal route. So what happens means the 0.1 ml of malin, which is an purified protein, which will be injected intradermally in the lower eyelid via tuberculin syringe. After 48 hours, there will be edema of the lower eyelid, purulent conjunctivitis, and blephroplasm will be noticed. This is about the Malin test. And if the animal will be showing these type of signs after 48 hours of injection, then this will be considered as the animal will be positive for the glanders. The another test is that Strauss reaction, where one required the pus from the suscepted animal. In a Strauss reaction, where one can collect pus from suspected animals, and that pus will be injected into a male guinea pig. After the injection of the male guinea pig, that will be injected via intraperitoneal route. There will be severe orchitis, and along with that, the scrotal sac will be swollen. If the guinea pig will be showing the symptoms like orchitis and the swollen scrotal sac, and that will be considered as the from where which animal the pus has been collected, and that animal will be considered as the positive for Glanders. Now one can go for serological test like the complement fixation test and dot ELISA, and uh, some other tests like complement fixation test can also be carried out. And we one have to be differentiate some of the disease such as ulcerative lymphangitis and the strangles, which is caused by Streptococcus equi, and epizotic lymphangitis. And lastly, to treatment of the disease, usually this is not to be undertaken treatment. So because of the genetic one, the slaughtering will be advised according to the Glanders and Farsi Act 1899. And finally, to prevention and control of the disease, clinical cases should be isolated and destroyed, and repeated screening via Malin test for every uh, 1 in a 3 week should be carried out. And disinfection of the surrounding, and quarantine and isolation of such strict measures should be carried out whenever the import and export of the equine breeds will be there. This is about the disease Glanders, where one need to remember some important points such as Glanders is an disease of Equidae family, which is caused by Burkholderia malai, which is manifested in horse as chronic form, and mule and donkey in acute form. Again, in a horse, there are three forms, where pulmonary, nasal, and cutaneous form. Cutaneous form is known as the Farsi, and when it comes to the pathogenesis, the contaminated feed and water will be enter the intestine, it will be absorbed, and there will be septicemic, and the bacteria will be localizing in those three systems, and accordingly the clinical signs will be manifested. And the important points to be remembered, that Farsi bud related with the lymph nodes, and the Farsi cord related with the thickening and cord like appearance of the lymph vessels. This is about the cutaneous when it comes to cutaneous form. And some of the nodules and ulcerative nodules will be occurring at the middle aspect of the hock region. Will be this one will be the important point. And there are two important diagnostic tests such as the Malin test, where one can inject the intradermal infrapalpebral route. The 0.1 ml of Malin purified protein will be injected. After 48 hours, the signs like edema of the lower eyelid, purulent conjunctivitis will be noticed. And a Strauss reaction, where the pus from the affected animal will be injected into the male guinea pig, leading to severe architis, and inflammation of scrotal sac will be noticed. So affected animals will not be treated, and they will be slaughtered under the act called as Glanders and Farsi Act 1899. Thank you.